Well, let's take you now back to Mpumalanga, where Tumelo Machogo is standing by. He's covering the story about a mobile lab that will be handed over to the community. How important is it at this time of coronavirus? Tumelo, a very good morning to you. Tell us more. No, still no, Tumelo? Tumelo, you're live on the agenda. Can you hear us?
Well, Dr. Mkhize is actually expected to arrive here in Ermelo any moment now. He's expected to meet with the MEC of Health here, Mrs. Saseskane Manzini, and also other health officials. They're expected to hold a briefing, in a close briefing with the department and also with the MEC. And then the Minister of Health, Dr. Zweli Mkhize, would actually donate, rather hand over to the Mpumalanga government a mobile lab that will actually be used to test people, that will be coming in to test people, and also to expedite results that will be giving out to people. But they're also going to door, going to the community, especially here in Ermelo, going to the community and checking if people here are also going out there to test themselves, and also to check if the people are actually staying at home, they're actually complying with the regulation to self-isolate, to socially distance, and to make sure that they also go out there to encourage people to go out and test. They're also expected to go to Ermelo Hospital. It's a hospital that has actually been earmarked in this province and here in this region to actually take care of the people who might come with symptoms of coronavirus. So those people, they will be treated in that hospital. So the Dr. Zweli Mkhize is expected to come here to encourage a lot of people here to go out there and test, but also more importantly is to hand out that mobile lab, because people have been asking, especially rural people in the community have been asking that they want to test because they have not tested. So this will be actually to help these people to go out there to test, and also to expedite results that will be coming out of those mobile labs that will also be used. But the community here, obviously, they will be excited to see the minister. They will be excited to hear that the testing actually would continue in this region. We remember that in Mpumalanga so far has only 23 cases of coronavirus that have already been confirmed in the province, and so far about 9 of those people have recovered from the COVID-19, but the disease, rather the virus, is still spreading throughout the country. So for people that are actually scared this is a strong message that will be coming from the ministry and then coming from the MEC to say to people, go out there and test, because it's important, because we all understand that over 90,000 have tested nationwide. So the number is not that high, that of the people who actually have tested. And also would put out the question to the minister. We remember that in KwaZulu-Natal, people, the unions there have been calling on the minister to actually to do something about the issue, especially when it comes to healthcare workers that are actually contracting the coronavirus. So we'll be speaking to the minister once he arrives here. We'll actually ask him questions about what is the department going to do, especially when regarding to healthcare workers that are actually contracting the disease, because they're actually taking out, because those people now have to be quarantined and has to stay at home, because it's already taking out numbers of healthcare workers that are out of the hospital, out of the clinics, that should be going out there to help people who are coming to the hospital presenting symptoms of coronavirus.
So, Tumelo, just talk to us about, I just want to get some clarification with regards to the screening process. Is today day one of screening, or has it been happening over the past couple of days?
Well, the province, the ABC of Health, Saseskane Manzini, has already been screening people in rural communities. Right. They've been going out in Nkomazi to other areas such as Bushbuck Ridge, because it's densely populated areas, and also those areas are actually quite rural. So they've been going out there to test people, to screen people, to test people if they want to test. But this area has not actually received any much of attention, especially when it comes to screening people people and actually testing people. So coming here, the minister, actually the people here, they will be excited because this region has not even seen a huge number of coronaviruses, but people here, they actually want to screen. So it will be a screening in this region. So also it's a region that is far from the cities, the Mbombela side of where the provincial government is actually at. So this region has not seen a lot of screening, and people here, they will be want to go out there and screen. And also with the mobile lab, that will actually help, especially to go to rural areas, to actually also get the test results as quick as possible, so that the people may know if they do have the coronavirus, so that they can actually self-isolate, they can actually stay at home more often. And if they have to go to work, they have to stay at home to self-isolate, to make sure that they actually don't spread the viruses to other people, and also to the people that they live with, especially in their households.
You know, testing is key, isn't it? Because it gives us a chance to refine our strategy in the fight against COVID-19. We were listening to Professor Abdul Karim the other day, and says medical practitioners can test up to 50,000 people a day, but currently we're only testing about between 5,000, 6,000 people a day. So it needs to be stepped up more and more in order to get a clearer picture of what we're dealing with here. You spoke about the fear, the anxiety among people at the moment. With, you know, the Mpumalanga, the number is over 20 in terms of confirmed cases. Talk to us about how people are dealing with this, how they're handling this fear. I mean, it's been 21 days. Initially, that the initial lockdown period was supposed to be ending at midnight tonight, and we're asking our viewers how they're feeling. What's your experience on the ground there in Mpumalanga?
Well, Blade, we've been actually driving across the province, actually speaking to people about their fears of coronavirus. People are fearful of the virus. People out there, they know that this virus is a killer virus, but the thing is, people are not getting tested more, and the testing, there's not enough testing station to test people and to screen people that may have coronavirus. But the people are fearful, even though some people, they still go out, even though they're defying the regulations, are staying in the street. We've been to Secunda, where communities actually were just standing on the road talking to their neighbors, where they're not actually social distancing themselves from other people, but people are fearful of the disease because people saying that they don't have enough water, especially in rural communities. They are fearful of that because they don't have enough water. Water is a scarce commodity, especially in Mpumalanga, where rural communities don't have enough water. Yes, they've been giving them the water tankers in communities, but they are still fearful because they don't have hand sanitizers, they don't have protective gloves or face masks to cover themselves. But people are fearful because they don't know what to expect with the disease, because they don't know what to expect rather with the virus, because they don't know if you get the disease, because they are looking at the numbers that are happening overseas with people dying in America, in Italy, and they are looking at those numbers. They are fearful that if this virus come to their community, it's going to wipe out their community. So people are fearful, but they're also hoping that the government can do more to help them to actually slow down or flatten the curve in their communities.
I mean, you were talking about America. The other day, America recorded over 2,400 deaths in one day, in one single day. So it gives you the extent of the problem in that country. You don't want to get to that stage here in South Africa. That's why we're talking about flattening the curve in order to give our health professionals a better chance in order to cope with any influx of positive cases. But Tumelo, we thank you very much indeed for your reporting. We'll come back to you in a short while when the minister arrives there. Tumelo Machogo live for us in Mpumalanga.